it true that you need to get bone graft when getting dental implants?
It depends. Let me walk through the scenarios with you so that you can kind of understand when you might need a bone graft. Let's start with bone. Bone is extremely important in your jaws for both the aesthetics that you have as well as the function. Bone acts as the foundation. It's what holds everything together and allows you to really transfer forces to food and be able to speak and all those things. So bone is really, really important. It's especially important when it comes to a dental implant because the dental implant sits inside bone. When you get bone loss around teeth or implants, bacteria now has the ability to go down further on the tooth or the implant, and that usually leads to bigger problems. So having enough bone is really, really important. You need enough bone for the implant and for your teeth. If you've lost bone around your teeth, you may not have enough bone around the implant either, and you might need a bone graft. There are really two different scenarios you should think about when it comes to a bone graft. The first one is you're already missing a tooth. If you're already missing a tooth, then chances are you've lost some bone. This happens, we know from research, 50% of the bone width and about 30% of the bone height goes away when you have an extraction, usually leading to the need for a bone graft. This is a unique kind of bone graft because the bone is already healed and it's already small and we need to layer on top of it. The second type of bone graft is what we would call a socket. A socket graft is when we are removing the tooth and now we have a hole. And that hole gets filled up with bone graft. That's an extremely predictable situation and by far the preferable way to do a bone graft. It's almost painless, it's cheaper, everything that you want about it is there when it comes to a socket graft.
What is the reason your bone starts to disappear after you lose the teeth?
Yeah, so the body is really smart and it will start to remove bone when it's not being used. An analogy I often will use is, say, a paraplegic, someone who has no use of their legs and they're in a wheelchair. You notice that their legs become kind of withered up. They're what we call atrophied. Atrophy is the body's response to disuse. If you're not using something, the body doesn't see any reason to utilize its resources to keep that thing there and keep it strong. The very same thing happens in the jaw. If you've lost a tooth, you are now no longer using that section of jawbone, and the body will, you guessed it, remove the bone that's there because it just doesn't need it. When you have a dental implant, now the bone is being used, and so the bone sticks around. People often will ask me, do dental implants preserve bone? And the answer is yes, they do, because they're loading the bone in that area and it keeps the bone around. The next question I often get is, well, would dentures keep my bone around? And the answer is unequivocally no. Dentures do not load the bone. They simply load the soft tissues. And this is actually the worst possible situation. If the soft tissues are getting loaded and kind of jostled around with a denture, but the bone is not really being stimulated, it actually gets bone loss at an accelerated rate.
When would a dentist know this person needs a bone graft?
The question is, where does a bone graft come from? And what does it actually do? So a graft is when something is taken from somewhere and put into somewhere else. People graft tree branches. You could take a tree branch from one tree and put it onto another tree. In the body, we can also do grafts from one part of the body to another part of the body, or we can do a graft between people. And so this is the most common type of bone graft that happens in the mouth. We call that allograft. Allograft is when you take a bone graft from someone else and you put it in a different person. And this is happening from cadavers that have been donated. And these cadavers are completely cleared of DNA and disease and all those types of things. The bone is essentially whittled down to the point that it's basically calcium, and it acts as a scaffolding. The scaffolding is really what we're looking for. We need a place for blood to fill and stem cells to kind of grow across and build bone. Your body knows exactly what to do. It just needs a scaffolding to kind of grow across and be able to build that bone. So bone graft really, at the end of the day, it's just a biological scaffolding That's it. Actually, if we did a biopsy of that area, we went back in and looked at that area some months later, we really don't see any bone graft anymore. We actually just see your bone. I often get the question of, oh, should I be worried about a bone graft? I'm a little reticent to have, a cadaver bone put in my mouth. In my opinion, you should not. This is maybe the most commonly used material in the mouth. I mean, this is done literally millions of times every single day, and the disease transmission is virtually non-existent. If you're going in for a consultation, you need to know what questions you should ask. We created a free guide that you can see below that will give you the questions that you should be asking to your doctor when you go in for a consultation, so that you can be well informed and you can go in with the right questions and hopefully get the right answers from your doctor.